Our debating focus this evening is the dengue and chikungunya problem that has gripped the nation. We've talked about this repeatedly as a problem in Delhi. It's no longer a problem in Delhi. As far as 36,000 cases of dengue have been detected across the country. Delhi, of course, is still the nerve center of mosquito-borne diseases as it's reached epidemic proportions. After the collective failure of the government machinery, the Green Tribunal NGT has slammed Delhi's civic bodies, the MCDs, for the spread of these diseases. Delhi's health crisis has been grabbing headlines, but the situation is far from rosy in the rest of the country. In Kolkata, the toll is rising every day. The eastern state has already reported 30 deaths due to mosquito-borne diseases. Tamal brings us this report from the ground in Kolkata.
If there had been 70 dengue deaths across the country this season, which is alarmingly high, at least 24 of those had happened in one state alone, that is Bengal. That's right, Bengal has recorded maximum number of deaths because of this vector-borne disease this season. In Bengal, the district of Darjeeling seems to be worst affected. But what came as a bigger shock and embarrassment for Mamata Banerjee's state administration is the fact that there had been dengue deaths in Kolkata, the state capital, and also adjoining areas like Salt Lake and Dum. Salt Lake is considered to be extremely posh an area. Mamata Banerjee did pull up civic bodies, and civic bodies, health officials now claim to be doing enough, taking enough combative measures. But question is, did they take enough preventive measures? Statistics show in 2015 alone, there had been more than 8,000 dengue cases and 14 people had lost their lives. This year, so far, there had been more than 6,600 dengue cases, but 24 people have lost their lives. Question is, did Bengal do enough to create social awareness, and also through proper fumigation, did the state try to keep the society, the neighborhood, clean, unaffected from dengue?
Well, Kolkata is struggling to get on top of the problem. In Maharashtra, Mumbai, the cases are rising every day. Doctors say the city is prepared to deal with the situation if it gets out of control, but it's far worse in Pune, which is having a very, very hard time. Latest reports from the state's health ministry tell us the patients from Pune as a city make up for 90% of Maharashtra's state's share of dengue cases. Ruchi Deshpande sends us this report from Pune.
About 90% of Maharashtra's dengue cases are concentrated in the city of Pune, if reports are to be believed. What we did find out from the Pune Municipal Corporation's health department is that out of the 439 dengue and chikungunya cases that Maharashtra has recorded, about 225 of them are dengue cases only from the city of Pune, and more importantly, about 393 cases out of those 439 are also from the city of Pune, but these are the ones regarding chikungunya. What the Pune Municipal Corporation told us is that it's only during this monsoon or this year that they have seen a spurt in the number of chikungunya cases compared to the dengue cases, but both the diseases remain a menace for the corporation to handle. In fact, they have also received an advisory from the state health department stating to up their surveillance measures regarding the eradication of anti-adult mosquito as well as anti-larvae going forward. Remember, the PMC has a budget of about 7 crore rupees to handle this menace, and they have already told us that they are using all of these funds to eradicate this problem of dengue and chikungunya going forward.
With the number of dengue patients increasing by the day in the city of Mumbai, we visited two of Municipal Corporation's biggest hospitals, the Shaina Hospital and the KAM Hospital. Now, we had a word with doctors in both these hospitals, and they told us that they are extremely well equipped to deal with the situation. They said they have increased the number of beds to increase the number of intake of patients when it comes to dengue. Also, they said when it comes to medicines, they are extremely well equipped. Some even went as far as to say that if the number increases 2 times, then also they can accommodate patients and take care of them. When it comes to medicines, they are saying they have a very good stock in both these hospitals to look after these patients. No deaths have been reported in both these hospitals yet. KM Hospital till date has close to 20 patients suffering from dengue, and Shaina Hospital has close to 15.
Well, citizens across the country are nervous and scared about the dengue and the chikungunya epidemic as we hear of a death toll for a disease that up till now everyone believed would not claim lives. Why has it gotten so bad this year? What do you need to do as a citizen? And what is our government, our various governments doing in various cities to stay on top of the problem? Joining me on the show this evening, Professor Dr. Sanjeev Bagai, Vice Chairman and Director of the Dwarka Manipal Hospital. Neerja Chowdhury is a very senior journalist recovering from the disease herself. Atul Goyal, President of URJA. Shama Mohamed, spokesperson, will join us through the course of the conversation. Shaina NC National Spokesperson of the BJP, and Dr. Fuad Halim, a medical practitioner in Kolkata, will join us as well. I want to start with Dr. Sanjeev Bagai. Dr. Bagai, you predicted, of course, that things are going to get much worse, and we are realizing that it's no longer just a problem that is specific to Delhi. It seems like the problem is currently at shocking rates across the country. What is going on this year that has gripped the nation in mosquito-borne diseases?
I think it's a combination of factors, and I think most of the problems which Delhi is facing would be about the same what most other metros would face. It's a question of a population bursting at its seams. It's a question of waterlogging. It's a question of sanitary facilities not being sufficient to drain the water. And perhaps this year the strain of dengue and chikungunya seems to be more virulent. So it is, after all, a virus, and viruses do get unpredictable. But with the monsoon, especially around the Delhi NCR area being till very recently on, generally the peak is around September, what we are seeing now. And even today, in my own practice, I've seen a host of patients with exactly the same symptoms of fever, rash, body ache, joint pains, and so on. So I think this would continue till about first or second week of December. But medically speaking, first or second week of October. But medically speaking, I think the cause really is a more virulent strain of the virus which we are seeing this year.
Dr. Bagai, is the virus actually mutating? We've had some reports of the fact that doctors in Delhi have complained about the fact that virus is currently resistant to some medication. They think it might be mutating. How bad is that situation?
Yeah, it's very difficult actually to say whether the virus has mutated or not. We know that dengue has 5 different strains and chikungunya has 3 different strains. It's very difficult to predict which kind of strain is going to be prevalent in which year. And it's almost impossible to predict whether the strain would be more virulent than the last year. But having said that, with regards to the medication, there's practically no medication at all, either for dengue or chikungunya, apart from symptomatic cure. And it revolves around paracetamol for fever and pain relief.
Shaina NC joins us on the conversation. Shaina, we know that the National Health Mission from the central government and the Swachh Bharat Mission have funds allotted to bringing down the problem of mosquito-borne diseases. In some cases, the central government has turned around, like in the case of the Delhi government, and said that you have 7 crore rupees left over from the previous year that was allotted to this particular problem that you've not even used. So how is the central government at this point, within the Swachh Bharat Mission, within the National Health Mission, making sure that the money that's being allotted is actually being used?
Faye, the money is not just being used on particular cases that have been identified, but also in the larger process of ensuring that the environment is clean. Now, for most of us that want people's participation when it comes to dengue, we should know a couple of facts, which I'm sure a lot of your viewers do know, but at the cost of repetition, let me highlight. Where you have construction sites and you have stagnant water, you have collection of water in drums, you have even in a flower bed in your own veranda where water accumulates, there is a certain kind of consciousness and awareness that needs to be brought about by citizens as well. And I'm sure a lot of municipal corporations are doing just this. If you take Mumbai, for example, the BMC has not just launched an awareness drive, has also ensured that small things like, children having a drink and then the cap of the bottle, if it accumulates with water, and there you see this kind of lava giving rise to an epidemic, even these are things that have been highlighted through advertisements. So costs that are spent by particular municipal corporations at their discretion on both awareness and as well as cure. I'm sure the doctor on the panel will know much more than me, but as far as Maharashtra is concerned and Mumbai is concerned, we had about 248 cases that were registered last year in September, and this year those cases are down to 130. If you see the unfortunate demises due to dengue, last year there were about 9, and today, this time in Mumbai, there are about 2. So I think that awareness also has a huge role to play, and we must identify that a viral infection is not an attack for where you need to go in for some kind of blood transfusion. It is imperative to also educate people as
Shaina,
we
if
talk about
I may,
Swachh Bharat, as we talk about awareness drives, and I think
if I may,
yeah.
The latest numbers released by the BMC tell us that up till the month of September, till the 15th of September, there were 2,058 patients admitted to civic hospitals with symptoms of dengue. 160 of these patients have already tested positive. In the meantime, nearly 400 cases have been detected in Pune.
That's exactly my point.
Yes, 400 cases have been detected in Pune. Yes. Let me finish. 400 cases have been detected in Pune, which is also the responsibility of the Maharashtra government, diagnosed with dengue. It is, while I agree that there is a civic responsibility for every citizen to make sure that there is no stagnant water around your homes, we've repeatedly talked about waterlogging in all of our cities. And I'm not specifically talking about Maharashtra here, whether we're talking about Bangalore, Delhi, Mumbai, Pune, all of these cities have had issues with waterlogging this monsoon, and we've had issues with garbage disposal this entire year. So on some level, it could be that at the local level, the message still hasn't gone down. At the local level, we still haven't managed to achieve our goals.
Let me please gently correct you. When you talked about so-called cases, does not mean that they are diagnosed and positive cases. The only way to ascertain is through a rapid test or through the ELISA test, which is now available at most government hospitals. So I think that people who are worried about a viral turning into a dengue case is sometimes a false alarm as well. So let's not get people, hyper about a situation. Let's make them aware about how important cleanliness is, how important it is not to have even little specks of stagnant water. And I think that all in all, this is not some kind of a competition to say that there are less cases in Maharashtra and more somewhere else, or less in Mumbai and more in Pune. I am not into that kind of I don't want to get into that kind of commentary, because the statistics will be to an advantage of obviously the municipal corporations, depending on where they've ascertained them from. But more importantly, what are we as a conscious society doing? Are we spreading out enough awareness when it comes to the kind of disease and epidemic that arise out of just stagnant water, even if it is in small quantities, and if it is in our homes or in our compounds or our balconies? Isn't that something that we should all be collectively talking about? I think that should be the role of this debate of yours.
All right, so let me put the phone number on the screen, and I invite viewers right now from any city that you're in, especially the cities of Pune, Mumbai, Bangalore, Delhi, the ones that are facing the problem, and Kolkata that's facing the problem so acutely at this point. If you have questions for the medical practitioners on the panel, please feel free to call us. If you have questions about government and governance, please feel free to call us as well. Dr. Bagai, you raised your hand, and I'm going to come back to you about the fact that yes, it's mosquito borne. We know that mosquitoes breed in stagnant water. How much of this is the fact that our cities are not clean, and how much of this is the fact that we might have a bowl of stagnant water or outside our balconies? Let's actually call a spade at this point.
I think I would like to make 2 points in this. The first point is, I don't think any state government program or national government program can be a success story unless until there is a majority, by majority, a public participation. So I think public awareness and every citizen contributing to keep his micro and his macro environment clean is of paramount importance. And I think very often a larger public can suffer because of our few negligent neighbors. So I think I'm driving home this point again. I think every citizen has to contribute, and the same citizens who stay in India, when they travel abroad, maintain their environment spick and span and clean. So I think there's no reason why we can't do it here in India. I think it's an indiscipline within us, and we need to correct that. The second point I would like to highlight for everyone who's watching this program is that all fevers are not dangerous. All fevers need not be dengue and chikungunya. Even if it is a suspected case of viral as dengue or chikungunya, 99.9% of these patients can be managed extremely well at home just with simple symptomatic treatment. I think by and large the awareness campaign message is of patience, it is of public awareness, it's of public education and involving a lot of school kids, because that's your catchment area of educating the next generation of what we need to do and what we should not do.
That's a point well taken, Dr. Bagai. What about the local municipalities? What about the MCDs? What about the local municipalities that are managing cities like Bangalore and Pune and Kolkata? Even if every citizen made sure that their surroundings were clean, is that enough? Will that solve the problem?
I think all civic authorities, which includes the Delhi, at least from Delhi's point of view, the Delhi local government, the state government, all civic authorities have to work in tandem. I am not going into any political connotations or any tangent per se, but I think all civic authorities have to work together. The point I would like to make over here, which is extremely critical, is that maintenance is never a glorification job. I think it's a 12 months a year job of maintaining the sewage lines, maintaining the drainage lines open, and making sure that pre-monsoon everything is kept intact. I think somewhere down the line Delhi was caught napping in that.
Right, Delhi was caught napping. And Karnataka, the number of cases in Karnataka, 9,427 cases of vector-borne diseases detected and diagnosed in Karnataka this year. This is not something we can just cross our fingers and hope will not happen to our families. It's impossible to keep the mosquitoes out of your home. What we need to do right now is look at this on a war footing and try and solve the problem. Neerja, when we talk about the problem, we talk about where the failure is at this point. Is it, while we take the responsibility of citizens, is there a collective failure here on local body, on local municipalities and local civic authorities as well?
Look, I want to say something very simple, and that is that nobody is taking charge of this. This is not an overnight development. And you know, figures are varying. You have talked about 60,000 on your program some days ago. I had medical people talk about over 5 lakhs. Newspaper have also reported of cases that go beyond 5 lakhs. Whether it's 60,000 cases in the country or whether it's more than 500,000 cases in the country, 500,000 is no small number, nor is 60,000. Any other democracy in the world with this kind of an epidemic, which happens year after year, figures may vary a little bit here and there. I was just looking at it before coming to your program. Last year it was 1.1 million cases that responsible journals had talked about. Any other democracy in the world, governments would have fallen with this kind. Where is the citizen most vulnerable? Where am I vulnerable? When I'm sick and I don't get what I need. And if that happens, in my neighbor's house, not one person, it's like 9 pins coming down. And there are families, bastis, where there's nobody to look after them. And actually nobody is taking charge. Central government, malaria eradication supposed to be central government responsibility, state governments, municipalities, and year after year that, we should work in tandem, public participation, we should do this, that and the other, but the drains in our cities remain so clogged. You travel anywhere in the country, defecation, open defecation. But what I'm saying is, hum log ko gussa nahi aata, that's why we're suffering the way we are in a democracy. And we need to feel the moral outrage in a democracy like ours. We dream of regional power, world power, what have you. If you can't take care of simple
angst and anger right now, Neerja, is your angst and anger against the central government, the state governments, the local municipalities? Who do we be? Who should we be angry at?
My anger is at the leadership. Everybody and nobody is taking charge. There is a blame game going on. It's state government, it's municipalities, it's central government. Well, I say it's an emergency situation. The PMO, where is the Prime Minister's office giving a clarion call? I want to know, where is Mr. JP Nadda today? What is he saying to the whole country? Where is the AAP government? Where is Mamata Banerjee? Where are our municipalities? What do they have to say? Take charge, be there, we've elected you. What have we elected you there for? It's year after year. You talk about water collecting. Do ghante ki barish and Delhi's roads will get flooded. Bombay roads will get flooded. Unplanned urban growth. Who's going to take responsibility for that? Are we going to see it year after year after year after year? Is this what we deserve as people of India?
Absolutely, absolutely, well said.
Better.
Absolutely, Neerja, absolutely. I want to bring in Atul Goyal.
Atul, this not because I've gone through it myself, but so many people have.
Atul Goyal, the numbers are very obvious. We have a national health mission. We have a Swachh Bharat mission that are aiming at, that should be working at health, that should have put this disease on the top of their priority list. Where has the failure been down the road? Just explain to my audience now. Who's responsible?
I'll just count two, three points. What Neerja ji has just now spoken is absolutely valid, what she has spoken. And there is no need of awareness now. There is a need of action and monitoring technically, but it is not happening. No one is taking responsibility of any action. No one is taking responsibility of the monitoring of the system. The officials have totally failed. The system is totally collapsing. But what is happening? We are there. You see, the governance pattern is where the role of municipalities and the government comes into, the RWA role starts from there. And RWA is doing fogging at its own end. RWA is taking initiatives at its own end. But because we are a failure, because the government authorities does not come to our rescue, the sewer is overflowing on the roads, garbage is not being taken away. So what do we do? It is not in our hands. But
Atul Goyal, when you say action, what action should we expect? If you say action right now, let's take Delhi or let's take Bangalore as an example. What action should we expect from our governments? If they acknowledge the problem and they move to solve it, what kind of action should be happening right now?
Action is, you must do your duty first. If the sewer is overflowing on the road, it shall not happen. It shall be immediately taken care. If the roads are flooded, it should be taken care by the concerned departments. But it is not happening around. If the kachra is lying on the roadside, where is Swachh Bharat? If the funds are collapsing and it is not being taken care, why don't you you give funds to the RWA? You give me 1 lakh rupees, you give 50,000 rupees to each RWA and see the reaction. And I assure you, by within no time the funds are available. RWA can make a lot of changes to the society. By this epidemic can be controlled. But nothing is happening around. Why it is happening around? The fogging has started just now in Delhi. Why it was not there in 2 months before?
Does the fumigating actually kill the mosquitoes? Does the fumigation actually solve the problem?
No, does not. It only kills the flying mosquito. It does not kill the dengue mosquito.
That's something to remember. Fumigating does not solve the problem. Just having your neighborhood fumigated will not solve the problem. Dr. Fuad, Halim, thank you for joining us from Kolkata. Kolkata is facing a huge problem right now with mosquito-borne diseases. 30 cases of deaths reported in Kolkata because of mosquito-borne diseases. Why is Kolkata facing such a problem? What has gone wrong this year?
I think so. It's very clear that one has to understand, and I would disagree with the previous speaker when he says that the system is collapsing. I would say there is no system. So the question of the collapsing system doesn't arise. If you look at malaria, dengue, chikungunya and other tropical disease, let me finish off, sir. These are tropical diseases. If you look at the medical education system, then the institutions teaching tropical medicine can be counted on the fingers of both your hands. There will be less than that in India. The number of corporations employing medical entomologists who actually follow breeding patterns of mosquitoes and are tasked with the job of controlling the mosquito population, you will not get more than 5 or 6 corporations in India who actually scientifically pursue this issue. Now let's be very clear, when nature conspires against the humankind, if we look at it as an interspecies competition, then in the monsoons, the monsoons are in favor of the mosquitoes. It is in winter when nature is in favor of us. So in winter, the overwintering population of the mosquitoes actually have to be controlled so that the loading population entering the monsoon period is low, so that you don't have a breeding explosion. Unfortunately, this very unscientific way of trying to run after the horse after the barn, it has left the barn, it has fled from the barn. A year after year is not causing any solution and not causing other than perpetrating misery on the populations all over India. The second simple point I'd like to make, if you look at malaria for
Dr. Halim, is the government of Kolkata prepared this year for what happened? Is the government of Bengal prepared for what happened, for the number of cases that have been reported across the state and specifically in the city?
Absolutely, they have not been prepared, because you have to understand that the mosquito populations over January and February, coming over from December, they naturally go down, and it's that time that you need to attack the mosquito population. If you attack the mosquito population in December, January and February, then you have a lesser loading population coming into the monsoons. That work was not done, and we had this huge explosion of the vectors, and we had the reservoir present here, and we were having this dengue epidemic over here. But one has to understand, if you look at the microscopic picture, where people will definitely have to take responsibility in overturning whatever collections of water that they have in their houses, but pockets are formed in lakhs and millions during the monsoons. Look at the palm trees, look at the trees on the roads, look at the transformers that are there. But during the monsoons, one has to be very clear, nature is conspiring against us. So that is not the time, but we have to do it. That's a separate matter, because there is no other alternative. But I'd just like to point out one other factor. If you look at malaria, the word itself is an Italian word, and malaria actually used to be an epidemic in the Mediterranean countries. Today it's non-existent for 3 simple reasons: good housing, piped drinking water, and covered sewerage. These are the 3 things that the Mediterranean countries, starting from Greece, spanning across Italy and across Spain and Portugal, they have adopted and given to their citizens as guarantees, which is why they've been absolutely, it's been possible for them to reduce the epidemic proportions of these 3 diseases. Having said that, the mosquitoes have not disappeared from the Mediterranean. One has to keep that in mind. Don't assume that in nature you're going to win the battle by eradicating the mosquitoes. The mosquitoes are not going to go anyway. You need to disrupt the dengue transmission patterns very scientifically, very concretely, and it might be purely a health issue, but one has to understand that if you do not guarantee good housing, you don't guarantee piped water, you do not guarantee covered sewerage to your citizens, especially citizens who live in compact areas, they are high density areas, then controlling these public health, vector-borne diseases, are going to be a problem. Beating around the bush is not going to help. Fogging is not the solution.
Right,
Telling people that they have to overturn
very well said.
Definitely
Very well
has
said.
to be given as an advisory, but you cannot get away from the concrete solutions that we as a human race have experienced over the past couple of years.
Well, these are very basic asks, and I want our audience to understand this, that we will push through this phase one more time and silently move on to the next year when this problem will reoccur, because the fundamental solutions are not being worked at. Good housing, drinking water and covered sewage, something as basic as that, is not being worked at. Shaina NC, tell me if the central government and the health mission, the national health mission, are seeing the problem of vector-borne diseases right now as a national problem that needs a national solution, because it's happening across all of our cities. These are problems, these are symptoms of a disease of bad planning across our cities and the lack of cleanliness across our cities. Is the Swachh Bharat mission and the national health mission looking at it from a national point of view? We don't have that connection with Shaina. We'll get her on in a little while. Neerja, you mentioned when we were talking a little while ago that you believe that this is a crisis situation. Is it a crisis situation that demands a reaction from the national government?
Of course, absolutely. I think this is a situation which really demands a response from the Prime Minister himself. I don't say these things, get the Prime Minister to speak on every subject. I'm not one of those who subscribes to that view. But on this, yes, today, the Prime Minister of India must address the nation, and please assure us that next year this problem is not going to be there the way we have seen it. Whatever now it needs to be done, that it will be addressed, and we similarly hope that this kind of a note will be struck by state chief ministers also. There is a long-term solution and there is the immediate thing. As I say, I live in Delhi, therefore I would now like a control room to be set up in Delhi and have control rooms in the regions of Delhi under it, so that you really address the problem on an emergency footing. If you need to address the public, do so. If you want to hold hands in hospital, do so. If you want to make sure that the blood tests are done free for people, because huge amount of money is also being charged. If you want to make sure doctors are actually available, all this must be done, and leadership must actually take charge. And this thing that one of your panelists talked about, and I've also read, the crisis of scientific personnel in this area who study breeding patterns. There is a crisis today that has been written about over the years. What do you do long term to address that? So somewhere I think, because the water is now going above our heads, we need now from the top levels of our leadership a word of promise that things are going to get better.
Absolutely.
And public health, and this is where we ourselves as citizens are to blame. Public health has not become a political electoral issue, and it really has to become that.
As citizens, what Neerja is saying is so right. In India, 4.7% of the GDP gets spent on health. That is less than half of what the world spends on health. Indian citizens are expected to bear their own health costs. 62.4% of the cost of health is borne by the people out of their pockets, and that's fundamentally the problem, that on a national level we don't see health as a big enough issue. Where is the Union Health Minister? Where is Mr. Jagat Nara? Shaina NC, if you can hear me now, why isn't the Union Health Minister reacting to the problem, which is obviously it's obviously a countrywide problem. It's in all of our cities.
Who says he's not reacting, Faye? I mean, you have your own assessment and suggest that, we are not doing our job when there is a conclusive project, not just in an awareness campaign, but also the facilities to detect dengue at every municipal hospital, every government hospital, and probably much more than before. You look at the statistics of malaria findings in previous years to this year, and you will see it's gone down 1/4. You take the lepto cases, they're nearly negligible. The dengue cases, there are so many false alarms where we feel that it could be dengue, but it's not. It could be a viral fever. I'm not for 1 minute suggesting that there is not more work to be done. There is. But if there are fogging machines in every single ward in most states today, that in itself is an accomplishment. I think people's participation is also something that is not to be diluted. We need to work collaboratively. If there are municipal corporations that are ensuring that there is no stagnant water and there is fogging in every single ward of large metropolises, we need to collectively see how we can best ensure that we don't give breeding ground. So I don't think that this is, and really what are we doing for our international investment by creating such a hype that this is a panic situation, and look at what's happening in India. Nobody will even think of investing in India. Let's please not make it into a panic situation where we do away with tourism and investment, because what we really need long term is all of that. So collectively, what the health department needs to do, there is a portal where people can even give in suggestions. There are suggestions which are being welcomed by the government. There are campaigns being launched by every municipal corporation. There are all kinds of measures to ensure that even the poorest of poor know about the problems of hygiene and cleanliness, and that's why Swachh Bharat Abhiyan is not just limited to a cadre or a segment, it is for one and all.
All right, so these are what the numbers are. In the last 5 years, communicable diseases in India have gone up 32%. Spending is up only 7% over the same period. Dr. Bagai, is it a panic situation or is it not a panic situation? What is your medical opinion right now?
Yeah, I think medically speaking, I would like to bring out just 3 or 4 very, very important points. One is malaria has been not only epidemic, it's been endemic all through the year in almost all parts of the country. But at this present point of time, especially in the metros, it is an epidemic. I will not say it's a panic situation because I think it's a question of giving a proper advice to patients that a lot of the patients can be managed at home. But the real point which I would like to stress and drive home is on preventive medicine. Unless and until we don't talk of preventing the disease, and this has to be done 12 months a year. I've mentioned this 12 months a year and I'm saying it again. It is round the clock, it is surveillance, it is monitoring, it is documentation, it is analysis, and therefore then we can have a program of disease control. Delhi itself, if you look at it, it's 18 million plus, including the transient migratory population. It's a phenomenal load which is filtering into one city. Likewise in Bombay and Bangalore. So I think we have our inherent problems as a country. But having said that, we need roads 12 months a year maintained. We need pavements 12 months a year maintained. We need the sewage lines on a weekly basis desilted and drained. Preventive measures is the key to prevent diseases. What we are doing at the present moment is actually curative medicine. We are trying to manage the symptoms after they've set in. But my advice is if we start working now, maybe we'll be in a better position for next year.
All right, in fact, here's a number that we should be reacting to. There's a national vector-borne disease control program run by the national government, which covers malaria, dengue, chikungunya. Now, this program has seen a 3% decline in allocation of funds in the last few years. Now, it received 482 crore rupees in 2011. It has received 460 crore rupees in 2015. We've actually reduced the amount that is going into this particular program to control this disease. I want to bring in Atul Goyal one more time. Atul Goyal, on the national level, are we paying enough attention to the problem?
You see, if you like you are telling the funds are decreased and the authorities are not acting as per the movement they should act or the behavior that they should behave, and the result is before you that there is an increase in the disease across the country, particularly in the metro cities. And why this is happening? There is a failure of the municipalities over there, or there is a failure of the elected governments over there, or the officials not doing their duty. This is what you see, the work of the official or the department cannot be taken over by the citizens. Citizen can take care of their atmosphere, but the other way, it is the other way around. So we need to have a cohesive force together where everyone is inclusive, and like Dr. Bagai said and the other panelists said, we need to work throughout the year to control this. Like say the season is now hot and it is alarmingly the mosquitoes are there, breeding point is there, and when it is cold you will not look for the mosquito eggs over there, or you will not look for the cleaning of the stormwater drains where water is lying and breeding is happening around. So we need to take care of the whole of the program throughout the year, and we shall have a program for whole of the year, and so that we can keep a check when the next year the season comes, of the breeding season comes, we have a good response that there is this dengue, malaria, chikungunya does not happen, or it reduces to a certain extent where it is not alarmingly increased. We need to work on that together.
Well, as citizens, it is not rocket science to know that you have to keep your surroundings clean, but at the same time, you have to also make your local municipalities accountable for the fact that our cities currently are a mess. Any one of the cities that we're talking about, the monsoon has been terrible. There's been waterlogging in all of our cities. Garbage has been a problem in all of our cities. We're going to run footage on your screen of garbage that we have been filming over the last couple of months since the monsoon began. There is a complete lack of accountability in all of our civic bodies right now. All of our civic bodies. And that's what our streets look like. Obviously, diseases are going to spread, and there isn't, like Neerja said, enough of a reaction from citizens. We're not angry enough. We're not upset enough. That is the city of Bangalore that you're looking at on your screen right now. We're not reacting to this enough as citizens. This is why we are all falling sick. I'm going to put on your screen also footage of Delhi. Delhi asked the central government, the Delhi state government asked the central government right now for 6.7 crore rupees to fight the malaria problem. It received 1.75 crore rupees, and it was told to use the 7 crore rupees from last year because that money was not spent. The allocation that was given to the National Vector-Borne Disease Control Program, only 42% of that money was spent over the last year. There is a lack of accountability in healthcare in general. Dr. Bagai, I want to also understand from you, when we talk about civic hospitals, when we talk about healthcare for the poorest of poor in our country, are we falling short? Are we managing to give them the services that they deserve?
I think healthcare deficiency in terms on three parts. One is deficiency of beds, deficiency of doctors, and deficiency of nursing staff. We've been highlighting this at so many numerous multiple national and international forums, and there's a long discussion to that. I won't go into that. But very clearly our percolation and spread of healthcare has to be in non-metro areas. It has to be at the bottom end of the pyramid. We have to reach the local areas where people don't have to travel far distances even for an acute illness. There have been numerous surveys in which patients for oncology and cardiac and other transplant services have to travel more than 300 to 500 kilometers to receive health care. So I think our focus has to be on primary health care. Our focus has to be on preventive health care, and really we need a 10-year rollout plan, and therefore then after 8 years or 10 years we'll be able to achieve something. My very strong advice is let us not do anything to tide over this year and look at next year. We must follow a path, put targets, put timelines, put achievable targets, and we must be held accountable. Each and every person, the healthcare system, the government, the local civic authorities, everyone has to contribute. Everyone has to have a responsibility towards making things happen.
Neerja Chowdhury, what sort of a responsibility can we attach at this point to our local governments?
Look, before I answer that, I want to say one thing very simply. This thing of, don't be alarmist. When the media also does programs like you are doing, don't get alarmist. And I think part of the problem is that we need to call a spade a spade. If there is an epidemic today, you will not be able to address it unless you call it an epidemic, unless you look at the magnitude, the scale of the problem that you have to address. If you said, push it under the carpet, it's not so bad, never mind, after all in 2-3 weeks it's going to be behind you, you are never going to be able to address that problem. Somewhere this year is a wake-up call to us. And whether it's the answer to your question of municipal corporations, of course, and they are not accountable. They are to blame. As I say, our state governments are to blame. You were talking about the amount of money spent or allocated. It's just over 1% of the GDP that's spent on public health in our country, which is not the case in other democracies which have overcome the smaller countries which have overcome the problem, and our scale is huge. So somewhere the urgency of it has to get to us at a gut level, and this is not happening.
This is not happening. In fact, and I want to bring in the other medical professional on this panel, Dr. Halim. Is it in Calcutta? Is it?
May I just come in, Faith,
yes, Shaina. Let me just bring in the doctor and then I'll come back to you. Is it a panic situation, Dr. Halim? Is this a situation where we need to press the panic button? Is the media being alarmist? Is the media blowing this whole thing out of proportion?
Well, it's very clear with the central government and the state government and the local municipal bodies creating this very stringent bar on how to diagnose dengue. I think so we are missing a number of cases that are actually occurring. because of the semantics over which test will actually qualify a patient to be accredited with suffering with dengue, that problem I think so is compounding it, because a number of deaths that have occurred may not be attributed to dengue just because of the stringent measures that the government is putting forward. That's why they would like to what you call see that everything is underreported, which is unfortunate and doesn't give us a total picture of what is happening. But concretely on the ground, as a medical practitioner and coming from the fraternity practicing here in Calcutta, definitely all medical practitioners are seeing a number of patients with fevers which are very strongly provisionally being diagnosed as dengue. There are a number of other fevers like chikungunya started off in Calcutta, and these things are there on the ground. That is the reality. It is happening everywhere in India. But one small little point I'd like to make, which I think so is important, that when we are giving the responsibility for individuals to take ownership of how to take care of the breeding mosquito breeding pockets in their households, let us look at the basic human behavior. If you are giving water twice a day, then the person living in a basti, he or she has to store water in her house. And it has been our experience that it is this water that is being used for the regular day-to-day activity that also contributes to the breeding of these vectors. So one has to again come to the question that if you don't give regular piped water, the basic human behavior of storing water will happen. And the mosquitoes are very clever. They understand our human behavior better than our politicians understand, better than our administrators understand. Our administrators do not understand that if you do not give regular piped water to people, they will have storage pockets in their houses. You can't expect somebody who has to run the house, wash clothes, cook, give a bath to their children to overturn all their water resources which they have collected and stored at home. Right. And these are the places where the mosquitoes are breeding. So you need behavior modification, modification not in behavior of the people who are living in bastis who are getting water only twice a day, maybe an hour in the morning, an hour in the evening. You need behavior modification, people who can understand what is actually happening in the dengue vector cycle.
Just to respond again, Shaina, I'm coming to you, but I want you to also respond to this. When you say that citizens need to do more, and here is data that Praja has given us. In the city of Delhi and in the services provided by the MCD, complaints received in the year 2015 about blocked drains, 19,327 complaints were received from citizens. About repairs and reconstruction of drain lines that were leaking, 1,095. Now, the number of councillors and the number of issues raised about this in the MCD, 69. 69 times it was. So in reaction to 19,327 complaints, it was raised 69 times. At the same time, one more thing I want to bring up. Drainage chokes, blocked drains, overflowing manholes, the number of complaints that were received in West Delhi, 3,635 this year. The problems and the complaints received on sewage in West Delhi, 10,214. Water supply in South Delhi, 23,951. Stormwater drainage in Central Delhi, 942 complaints. These are active citizens who picked up the phone and called someone, but the issues raised by councillors and by MLAs are in single digits in reaction to this. The solutions are in single digits. The problems run in thousands. Where is the solution? Shaina NC.
Faye, let me first please respond to Neerja ji. I take her comment in good spirit vis-a-vis panic, but I want to definitely say that press the panic button if there is a genuine case of panic. If there is no confirmation of dengue in a lot of cases,
everybody on the panel, including two medical professionals, agree that it's a case of panic.
Please.
Two medical professionals on the panel agree that it's a case of panic.
I just want to let me complete my point.
Okay, go ahead.
Let me please complete my point. There are cases where private practitioners have told people, despite the fact of whether they have 20,000 platelets or 85,000 platelets, that to go for a blood transfusion please do understand that the doctors also have a responsibility which needs to be brought to light. There are systems to avail of a rapid test.
And that issue is there, but whether it's dengue or not should not be disputed.
Please, sir, I listen to everyone. Let me please just complete my point.
You're giving, that's wrong information. Whether it's 80,000 or 20,000, both of them are dengue.
But Shaina, 70 deaths that are confirmed. 70 deaths are reason for panic, aren't they?
Its job when it comes to fogging, cleaning of nalas, drains, provision of water. Yes, these are all things that have to happen. But there are also cases where you have below a refrigerator water that is accumulated, and there you have cases of mosquitoes breeding. So I think that holistically, when we talk about a Swachh Bharat Abhiyan, it is not something which is to say that we have absolved ourselves of our responsibility. We will continue to do what we need to as the health department, the government of India,
react to the fact that as basic as this, like Dr. Halim said,
the statistics that you talked about.
React to the fact that Dr. Halim said, and I'll go back to Dr.
complete my point.
Okay, all right, complete your point, and then I'll bring the two doctors back in again. Complete your point, Shaina. Go ahead.
I don't want to defend the wrongdoings of any municipal corporation, irrespective of whether it belongs to BJP or Congress or any other party. The important point is, yes, if there are cases of legitimate complaint which have not been acted upon, the administration has to be pulled up for it. But if the administration on a daily basis is ensuring that fogging, water clogging in your particular ward, that's why we talk about citizen vigilantism, because if you are vigilant in your individual area, we will see a much more proactive response of administration with people. I am not for 1 minute saying put your hands up and say
I refuse
that this is not the work of the government.
Shaina, on that point,
it has to spend the money which is allocated.
21,000 complaints about drainage in Delhi and no reaction. 10,000 complaints about drainage in Delhi about sewage, no reaction. 13,000 complaints about unauthorized construction, drainage blocks, no reaction. So I think that citizen vigilante, citizens getting involved has not technically shown us any sort of a reaction so far. Dr. Bagai, you said the last time you were on the show that the numbers are actually being underplayed, that the real numbers are a lot worse than we are reading about, a lot worse than we're hearing in the reports. Like Neerja rightly pointed out, we have no one agency collecting those numbers in a responsible fashion. So actually telling us that this is being overplayed or panic being created by the media, which is sort of giving India a bad name, I think that might be the wrong way to look at it.
2 points in this. First point is, in a very large country like India, where you have government, municipal and private hospitals, and you have a host of private clinics, and now in Delhi you have these mohalla clinics, and you have practitioners working in various NGOs and so on. True data collection is always a challenge. But having said that, there are a host of fevers. I think the most common presentation for almost 5 or 6 months in a year in most medical practitioners would be fevers. Most of the fevers can be underdiagnosed because a lot of the tests which are done are not the most sensitive, or the timing of the test may not be accurate. But having said that, I think the most important thing is most of the people in the general public are harping on platelets. And I want to reassure everyone, the total number of percentage of patients which actually truly on medical grounds require admission are extremely low. The patients which actually require admission and indeed platelet transfusion or blood transfusions are even more low. Even platelet counts of less than 20,000 or 15,000 or 25,000 can be managed without platelet transfusions. I think the carry home message, which actually has from a medical orientation point of view, which I would like to give, is concentrate more on the hemoglobin. Higher the hemoglobin, more the platelets get eaten away. So therefore, hydration of a patient during fever at home is really the key part of the management. Just focusing only on paracetamol and no other antipyretic, no other painkiller medicine is the key.
All right, paracetamol
and true analysis,
hydration.
Epidemiological profile point of view of fevers in India would be very difficult.
All right, paracetamol and hydration. But Dr. Bagai, is the problem being underplayed or overplayed right now? Because whether we're talking about platelets or we're talking about hemoglobin, dengue is dengue, chikungunya is chikungunya. We're not talking about whether or not people need to be admitted. We're talking about the number of cases that we're seeing in the country.
Let me put it in this rational manner. I think the true number of patients, if every patient of fever on day 2 or day 3 is screened in, let's say, 8 or 10 major metros, maybe the true number would be much higher. But the fact is, a lot of these patients are subclinical. A lot of the tests which are available are IgM, ELISA tests, antibodies, which are not the most sensitive. A lot of the patients, the timing of the test are not accurate, and a lot of the patients don't get the test done. But having said that, the true number of patients would be higher than what we are documenting. That is a fact.
All right, we've run out of time on this show, but it is true that the true number of patients are a lot higher, that it is a panic situation. The media is not playing it, out of, we're not blowing it out of proportion. It is actually a panic situation. There are doctors on the panel who have said that making sure that the patient at home, as soon as they're diagnosed with any sort of fever, are hydrated enough is the first step, and then getting the right tests done to diagnose properly is the second step. But if at home you find portions of your neighborhood that are not clean, if there's water leaking out of drainage pipes, if there's sewage on the side of the street, if there's garbage on the side of the street, connect with us. Our contact details are on your screen, and we will inform the local municipalities. We will follow up with the local municipalities and make sure that the problem is solved. Because if it is not, we will know. My contact details are on your screen. Get in touch on Magicbricks Now. Thanks for watching.
You can watch live TV on our website mpnow.in. Find us on Facebook at facebook.com/MagicBricksNow. And don't forget to click the like button. You can also follow us on Twitter at Magicbricks Now. To stay updated with all our programming, hit the subscribe button on our YouTube channel by logging on to youtube.com/MagicBricksNow.